Navajo County Public Health Services District is public, personable prevention.
Hey, it's Birdman, and this is a special edition for the Navajo County Public Health Services District here with Navajo County. Today with me, I have Michele Sgambelluri.
Very good.
Yay,
Yay.
I got it. You have a very differently spelled name. Yes,
And you can spell
you covered
it
it. No, I cannot spell it. I'm not even going to try. I'll fail that test. What is your official title here with Public Health?
I'm the coordinator for the Prescription Drug Overdose Prevention Program. It's a grant that we have through the CDC, and the major function of the grant is to get doctors signed up for the prescription drug monitoring program in Arizona. And right now, well, when I first started, we were at a little over 50%, and right now we're up to 87%. And unfortunately, in February, they switched their program over, and we have not gotten any lists of doctors anymore about who's signed up or not since January. So it's hard to know who's signed up, but in October it becomes mandatory.
Oh, okay. So in October, they say that's it. You don't get to choose.
The other 13% have to be signed up at that point.
Right. Okay.
And they have to actually use the system. It's not just being signed up, it's using the system, checking a patient before a patient is prescribed an opioid, well, a Schedule 2, 3, or 4 drug, which are mostly the benzodiazepines and the opioid painkillers. They have to look up a year's history of dispensing history, not prescription history, but dispensing history, because some people take a prescription home and they never get it filled. So anything that's been dispensed to a patient through a pharmacy will be in the PMP, and the doctor can see who's prescribed it, what's been prescribed, how many pills, what the strength was, so that they can determine whether or not they're duplicating, or they can see if a patient might be doctor shopping, because some patients do that, and sort of maybe nip in the bud a patient's possible growing addiction to these types of pills.
Right. Now, most recently, we always seem to have a celebrity that steps up and makes this a nice focus for us to understand. So most recently, we had Tiger Woods, who decided to mix some medicines.
And that's the problem. That's another good reason for having the prescription monitoring program, is the doctor can see if a patient's been already been prescribed a painkiller, already been prescribed a benzodiazepine. So if somebody who's already on a prescription for benzodiazepine, which is like a Valium type of prescription, when you prescribe a painkiller, they act synergistically. So somebody who's already on a benzo, we'll call them benzos from now on.
Right, benzo's fine, yeah.
Well, somebody who's on a benzo already, and then they're going to be prescribed an opioid painkiller, they are both depressants. So they depress your breathing, and they work better together at suppressing your breathing than they do just by themselves.
Wow.
Now, when you combine alcohol with that, that's even a better combination to allow somebody to stop breathing.
And
so
when you
they're
say
very,
better,
very dangerous.
And when you say better, let's be clear.
That's a sarcastic.
You're not being good. You're
no,
saying
that's not
better
a good
in a way is
that's,
to better way to kill yourself. Yeah.
Exactly.
Yeah.
It's not a good better.
Yeah.
It's a bad better.
A bad better. Yeah.
Yeah.
So sometimes they say that's stupid easy or something. People are like, oh, it's not
Yeah.
stupid. But
no, but
yeah.
So and unfortunately, with younger people who are out partying, particularly. They're taking these illicitly, and they're drinking at the same time, and they don't really understand the combinations. Now, I could be taking an opioid painkiller and go home and want a glass of wine.
Right.
And unfortunately, if I have some comorbidities such as COPD, sleep apnea, that lowers my breathing rate to begin with,
Crazy.
or a problem, other problem breathing, then again, that disease process, in addition to the drugs, in addition to the alcohol, just makes it worse and worse and worse, and your breathing can get slower and slower and slower, and eventually go into an opioid overdose.
Now, most of these things we're talking about from a physical issue, that you're addressing a physical issue, but also there's also mental issues that you address with certain drugs that then sort of can interact. So this will be nice
Yes.
because typically a physical physician will think about other physical physicians, but they may not think about the mental side of things, will they?
Yes, and this is the unfortunate thing. If you have a prescription that you get filled at the drugstore or wherever, that goes into the PMP. A doctor, however, if you go to say a new PCP, or even if you don't go to a new PCP, even if you've gone to your PCP for a long time and you have some mental health issues and you go to say one of the local uh, you know entities that
Right,
deals in
right.
that's a whole different issue. It's a HIPAA issue,
hmm
and
Now, will they be?
your PCP may not be privy to those records, so they may not know. One of the things that's not included in the PMP is methadone.
Okay, yeah.
Okay, methadone clinics.
So,
They're in a silo sort of all by themselves. They do not have to report their patients getting this drug into the PMP. Methadone is a huge
hmm
painkiller, addictive substance that is used to treat. It's an actual addictive substance itself, but it's used to treat an opioid addiction.
right.
If a doctor doesn't know that you're using methadone and you're not forthcoming with that information
So here's
because of stigma or whatever,
right.
or you just don't want them to know and you are doctor shopping for some more pain pills, those pain pills on top of methadone can also kill you too.
Right. So, this is the people that are shopping for the pills, they're
Mm-hmm.
going to be shopping for the pills regardless. They're going to try to figure ways around this.
Correct.
The thing that I don't want happening is people thinking, well, now the system's in place, so I'm 100% protected. It's still, they have an onus on themselves to share everything with their doctor that they're
Oh,
being
absolutely,
prescribed.
absolutely. And the guidelines, the prescribing guidelines that came out through the CDC and through the Arizona ADHS, the Department of Health
hmm
Services in Arizona, all recommend a whole litany of things to do when you're prescribing an opioid painkiller.
Right.
And a lot of that has to do with doing urine testing to make sure that your patient, number one, has the medication that you prescribed in their system. Because some people aren't taking their medication, they're going out and
Right.
they're diverting it, which means that they're probably selling it to other people or
Or
giving it to other people or just not taking
or
it.
they're in denial. Let's
And
face it, that's a thing too.
and you want to make sure that the patients that you're giving an opioid painkiller to are on other drugs. So you can find the methadone, you can find heroin, you can find fentanyl, you can find uh, benzos in the patient system, so that you know what they're on. And if they're not forthcoming about that, then that's a reason for some doctors to fire their patients
Right.
if they're not cooperating the way that they should be.
Well, I know in having dealt with some of the other business or the doctors up here that they have a contract
Yes.
that they'll say that here, if you're going to get this, you're going to have a pain contract.
Contracts, pain, urine testing, pill counting, and it sort of makes you feel like, as a patient that you're sort of maybe doing something wrong,
hmm
but people really shouldn't feel that way because these are the new guidelines. I mean, these are the guidelines that the government has put out,
Right.
and guidelines, if somebody's prescribing these medications, this is a way for them to keep themselves from liability.
Yeah.
So,
Back to that privacy thing. The only
mhm,
time you create a list, people are like going, well, now I'm on this list, and who's going to have access to the list? These are
right,
protected by HIPAA, first of
right.
all. The primary thing is as an Overwatch is to make sure that the doctors realize, because there's a lot of balls in the air, and the doctor needs at least to have a heads up as to what else is out there.
Correct.
But you have to be part of your safety.
You have to be responsible.
Yes.
That's the catchphrase. You have to be responsible, and a lot of times people don't want to take that responsibility. They, and it's like just with other medical issues.
Right.
I've been in the medical field for a long time. I'm actually an X-ray nuclear med tech. I cannot tell you how many times patients don't tell their doctor stuff. They'll tell me that
Right.
as a tech. They'll tell me that, but they won't tell their doctors. And I look at them and I say, you really need to tell your doctor that, But sometimes people are embarrassed.
Yeah.
And I said, well, you really shouldn't be embarrassed with your doctor. It's like you shouldn't be embarrassed with your spiritual advisor. You need to tell. You shouldn't be embarrassed by with your mental health provider if you have a mental health provider. I mean, with certain people, we just shouldn't. We should be sharing everything that we know about what we do, because it can be life threatening,
Okay.
and that is a big problem.
So let's drill down into the why. We understand what's logistically going on, that they're tracking these things. Why is this all become such a focus? And it's because of what's happening with opioids, isn't it?
Yes, we have. As a matter of fact, the DEA just did an announcement with a bunch of people, the DEA and the Department of Justice, I believe it is, today, talking about how opioid deaths are the leading cause of death for people under 50
Wow.
in this country now. And Arizona just came out with their 2016 report that I believe you're going to have a link to.
Yeah, we'll put that link up here.
If anybody wants to read the report, it's not a long report. It's not difficult to read. There's a lot of information in there. And we had last year, we had 790 deaths from opioids alone.
In Arizona.
In Arizona, there were. Let's see. I'm sorry. I'm just looking at this.
Well, we want to make sure.
About 1,500 drug overdose deaths.
Wow.
790 of which were opioids. So, and opioids last year surpassed the number of car crash deaths actually in the country. Opioid deaths are now, larger than car crashes and gun violence.
Well, gun violence. Yeah. So here we have now the leading cause has always been vehicles. I mean, it's always been vehicles ever since the vehicle came about, and it was
in the last couple of years, it's opioids.
It was horse-thrown issues, and now opioids is overtaking that.
Yep.
That's a very scary kind of, and the numbers are not really down in car deaths. Let's put a focus on that. While they did come down quite a bit whenever they added airbags and seatbelts, they've stabilized around a certain point. So we haven't had a drastic drop in car deaths that allowed the opioids to overtake it. They've actually physically overtaken a number.
And a lot of the increase in the opioid deaths has been because of heroin. And the increase in heroin deaths, because heroin deaths have always been very, very stable. If you look at the line for heroin deaths, it's been very, very, very stable until the last 4 or 5 years. And the reason for that is fentanyl or carfentanil mixed in with the heroin.
Yeah.
So that's the reason why the heroin deaths are up.
And they can get that product, the heroin and the fentanyl or carfentanil, added to it for cheaper.
Oh, fentanyl and carfentanil, well, fentanyl especially, is extremely cheap to make compared to even heroin. And a lot of people now, I tend to get off in tangents.
It's okay.
One of the reasons why people have gone to heroin is because of these PMPs. A lot of it, doctors are looking and saying, you know what, we're not gonna prescribe this to you anymore, for whatever reason. I think you might have a problem here, so we're gonna try to wean you off of this medication. Patients, a lot of patients will get themselves weaned off the medication or get them down to a reasonable level instead of being up at a high level of the drug that they're taking. There's a certain percentage of people that once they've just even started once, tried once with an opioid painkiller, they like the way it makes them feel, and they do not want to be weaned off. So they will start looking for other sources of their opioid. The cost of, say, a 40 milligram OxyContin is about $40 a tablet.
Okay.
The same high you can get for $5 in heroin. And the problem with heroin now is it's about 50%
It's
pure
it's just funny
compared
to
to
me that you have to.
5% pure back in the day.
It's the problem we have with heroin now.
The
Yeah.
problem we have with heroin now is that and the same thing, well, I'm not even going to go into marijuana,
Right.
but the same, it's, today's heroin is about 50% pure,
Right.
and it's really cheap. So people can start, people, that are been taking pills, opioid painkillers in a pill form, they might have been crushing it up and snorting it because it gives them a faster high.
Okay.
So they're used to that. So you can snort heroin. Never used to be able to snort heroin to get high, but you can now. You can ingest it to get high. So that's how people start with heroin, saying, "Oh, I'm never going to inject heroin. I'm just going to snort it like I do my pills." Within weeks to months, some people actually take up to a year or so, but for the majority of people, it's weeks or months, and they're injecting heroin.
Right.
And then it's just a downhill slide from there, which is an unfortunate thing. But that's how people start on heroin. And
So they get on the heroin and they get on the additive that they're adding is
is the fentanyl, and that's cheaper. So and this is specifically the white powder heroin. The
Right.
black tar heroin is really hard to adulterate without somebody knowing that it's adulterated.
okay.
So it's the white powder heroin that's predominantly cut with the fentanyl. Fentanyl is very, very cheap to make, and what people are doing, and oh gosh, I read so many of these at work. I have an opioid news link that just lists all the horror stories on a daily basis. But there was a recent bust, I believe it was in Oregon,
Okay.
of three or four people who were taking fentanyl, pressing it into pills that look like an opioid painkiller,
Right.
and
Delivering that out.
selling them as painkillers because people don't look at them closely. They don't know what they're getting.
Now,
And that was the problem with Prince. He
Yeah,
actually
that's what I was
had
getting at.
OxyContin that was all fentanyl.
wow.
And whether people know that or not, don't know. Some people know that they're getting fentanyl. It's a much more potent than heroin. But on the other hand, it's so potent that, and if you're not used to having it in your system, it can kill you very, very quickly.
Yeah. And now, if they get somebody with an overdose in this, they have something that they inject them with, right? But yeah, give me some of the limitations there.
Yes, and this is what we're doing this weekend.
Okay.
On Friday and Saturday, we're having some presentations on naloxone, and naloxone is the generic name for the opioid overdose reversal drug.
Okay.
And there are multiple different types of naloxone on the market. The one that we're going to be dispensing at the end of our presentations is an injectable form of naloxone, an intramuscular form, not IV, intramuscular.
Right.
And the Sheriff's Department actually has some injecting devices. They're auto injectors, and they talk to you, much like an AED does. So when you take the little film off the auto injector for the naloxone,
Right.
it talks you through how to give it to the patient. And it's very similar to an EpiPen. So, then there is another one that's very popular. It's a single dose nasal spray. It's called Narcan. Narcan is the actual
Right.
trade name. And right now in the White Mountains, the only place that you can get Narcan without a prescription is at CVS Pharmacy. And they just started that recently. There was a press release between the governor's office and CVS within the last couple of weeks that all CVS pharmacies will be dispensing without a prescription. And that was actually signed into law last year by Governor Ducey in May.
Wow. Okay.
So,
And that's good in a way that it helps people, but bad in the way that it's needed, right?
yes, and one of the things in the report, Arizona's opioid report, was that last year 18% of people who were given naloxone by EMS personnel, needed multiple doses.
Wow.
This year, as of June 1st, that has gone up to 27%.
Wow.
So, and this is probably most likely the fact that fentanyl is mixed in with whatever opioid that they're taking,
Right.
because fentanyl is so powerful that it generally needs multiple doses. There have been instances where you hear about these multiple deaths,
Right.
overdose deaths that happen, and that's generally caused by fentanyl. People not knowing it, not being used to it, and it just kills them. Some of these folks, the EMS personnel are giving up to 4 and 5 doses of naloxone, and still not reviving them.
Wow.
Yes, so it's very, very important. And up here in the White Mountains, we last year we had about 26 deaths. So if you look at the maps for overdose deaths, it's always 20 plus. That's the highest that they go. So I always like to say just 20 plus. We're at 20 plus, so we're at the highest,
Indicator.
yeah.
Really.
So and that's per 100,000. That's a dose. That's a death rate. So
Right.
we have just about 100,000 people up here in Navajo County. And most of the people that died of a opioid overdose or a drug overdose, and the majority of them in Navajo County were opioid related, or they were polypharmacy, and they involved an opioid
Right.
along with other things. Most of them were most of these people overdosed at home or in somebody's home, whether it was a friend's home or their family's home. They overdosed at home. So it's very possible that if people, knowing that their loved one was abusing an opioid or other drugs, that they might have had a chance to save them if they'd had naloxone on hand.
Right.
And that's what our purpose for the presentations this weekend is to give out naloxone to people who are either using a prescription painkiller the way it should be used. You can still overdose. If you have somebody who is abusing an opioid, whether it's a legitimate prescription, whether it's street drugs, whether it's heroin, I strongly encourage all those, or whether you are doing it.
Right.
If you're abusing it and you don't have naloxone on your body at all times, that's probably not good. And we encourage you to come into the presentations and get your naloxone for free.
And when are the presentations once again?
The presentations on June 9th, which is Friday, we're going to be at Northland Pioneer College at the Learning Center from 9 to 11. Northland Pioneer College, the first one in Holbrook from 9 to 11. Northland Pioneer College in Winslow from 1 to 3 at the Learning Center. We'll be at Silver Creek Pharmacy that afternoon from 5 to 6:30. And that is in Taylor. And then on June 10th, which is Saturday, we're going to be at the Show Low City Hall Chamber City Hall Council Chamber, from 10:30 to 11:30.
Okay, so we're going to put the show up on Thursday, so people will have at least some time to make it. But let's say they're watching it after these events. What's another way for them to get information, to get connected? Do they come to the health department? What do they do?
Well, they could call me,
Okay.
and I can get them in touch. Or what we can do is put a link to Sonoran Prevention Works,
Yes.
because Sonoran Prevention Works is the group that's out of Phoenix. They're a harm reduction organization, and they're not for profit. And they actually have the way that they're distributing this naloxone is they have a contract with Arizona Medicaid to distribute 20,000 doses of naloxone in the state of Arizona, and that does include the Indian reservations. So that's everywhere.
Awesome.
Anybody who wants to contact them can contact them to get the naloxone. And again, the sheriff's office through Navajo County, I believe, has some of those auto injectors that they can distribute out also.
Cool. What else do people need to know?
Come to the presentations. If you can't come to a presentation, go to the CVS without a prescription. If you have some health insurance, go to your doctor. Any doctor can prescribe to a third party. My doctor can prescribe me naloxone because I know somebody who might need it, and I'm around that person a lot.
Oh, okay.
So that was the bill last year that Governor Ducey signed. Third-party prescriptions by prescribers, and pharmacists can prescribe or can dispense without a prescription, although most pharmacies are just not set up for that yet.
Right. Cool. And that'll be all for now. And hopefully we'll follow up and find out how things are hopefully getting better, right?
Yes, that would be nice, but we don't really see that in the near future. So, but thank you very much for letting me come on.
Thank you very much. Look down in the liner notes below for any more information about this. If you're wondering why you're hearing about opioids everywhere, it's because it's a serious issue. It's overtaking car deaths, and that's pretty significant since almost everything you look at almost daily, you see something about a car accident and somebody dying in a car accident. Think about that and then realize that somebody's dying from opioids, which is hidden away in rooms, in houses, in hospitals. You don't see it directly in your face like a car crash.
More people died of opioids last year than died in the Vietnam War.
Wow. Last year.
Nationwide.
Okay. Nationwide. Okay. So, folks, that's going to be it for this episode of Birdman in the Mountain. I want to thank also, this is a special edition for the Navajo County Public Health Services District. I'm Birdman. This is Michelle. Thank you very much.
Thank you.